We've recognized the need for dialysis services at CMH for a really long time. In fact, before the pandemic, we had been working on plans for a dialysis center and knew that there was opportunity for that for a number of years. So with Dr. Davis coming, it gave us the opportunity to relook at those plans and go back with our team and plan what that facility would look like. We began a relationship with our architects, and Steve is our director of facility design, and he helped us plan this project. So Steve, you might start off by how he went about vetting out an architect and contractor for the service.
Sure. We looked out at what firms that were available to us in the region that had experience with dialysis clinics, and we found a firm in Kansas City, Pulse Design, that had worked with many of the bigger providers of dialysis in the region, and they were willing to work with us. So as we engaged them, they were excited about our concept. Since we were a standalone building, we weren't in a strip center, we had the opportunity to kind of custom fit this with the patient in mind. That led us down the road to designing and being able to take advantage of our site with our views and being able to talk about concepts that were really patient focused and not so much center focused. And we took a lot of the time to arrange the chairs in such a manner that the patients have views to the outside, and develop a program based on our needs and not just a cookie cutter response that you see from a lot of the different facilities that are out there in our region.
Another aspect of this that I thought was really important was making sure that Dr. Davis was present in the facility, not just when he's in clinic, but also when patients come in for dialysis. So we've added the nephrology clinic as a part of this project. You might describe what we've done in terms of being able to match up the clinic and the dialysis center.
Right, this clinic actually is more than a clinic, it's a center. So we do have the in-center hemodialysis treatment area, but we also have an area just for the clinic. So the patients that arrive at campus don't have to seek the physician out in a different building. It all happens in one spot.
So I think what people are going to find is that this isn't just a new dialysis center. This is going to be the best dialysis center in the region, and for that, I'm really excited about people being able to experience this. Dr. Rusty Davis is our new nephrologist. He joined CMH in this fall, in September, and he brings a lot of great services to CMH.
What I'm most excited about from the dialysis unit is the design for the patients that are going to be doing chronic long-term in-center dialysis. As someone that's been in several dialysis units, oftentimes they're in strip malls or they're in buildings where there's not a lot of windows. All the patients are in a very confined space, staring at each other. And the good thing about this design for the new building is everyone will be in their own space, facing a glass wall of windows, and get to look out at nature and have a very open concept with a lot of state-of-the-art equipment that will be soon to come. Yeah. So also, other than just the in-center, we're hoping to have a very large home dialysis training area, and then also allow patients that are in need of peritoneal dialysis and home dialysis to have a place where they can come, have a machine that's easy for patients to use, both on the peritoneal dialysis and the hemodialysis side, so that we can have a successful home dialysis program, which I think is very important, especially in a community where people are working, would like to continue to work, have that autonomy, be at home, and live their normal life without having interruptions with going to the dialysis center during the day, 3 days a week. So very excited about that.
Dr. Davis has already been actively engaged with us over the last year at planning what that means for CMH in terms of adding nephrology to a clinic, to our inpatient units, to our long-term care facilities, to our home programs. And I'm just really glad that we found a nephrologist to join CMH, has great training, is going to be a great addition to our medical staff, and we're really pleased that he joined CMH and look forward to the expertise he can bring and to the growth that he's going to bring to the services we provide. On behalf of Citizen Memorial Hospital Board of Directors, allow me to welcome you to the groundbreaking of the CMH Dialysis Center and Nephrology Clinic. This development will have a significant impact on the lives of so many citizens who reside in CMH's service area and their families. The Dialysis Center and the Nephrology Clinic will include a 16-chair in-center dialysis unit. It'll have 4 home dialysis training rooms. It'll have 6 clinic exam rooms, patient education and consultation space, areas for laboratory and other support services. All of the care areas will be appropriately sized and aesthetically pleasing with beautiful scenic views. This center truly is a game changer for the level of care that CMH is able to provide in Bolivar and our surrounding communities. But not only that, but it's going to be life-changing for so many people in our communities, and for that we're just thrilled to be able to get this project started.